For those of you that I've not had the chance to meet yet, my name's Donna Dyson. I'm a National Marketing Director with the Juice Plus Company. Today, my hat is as the chair of the Health and Wellness Committee. And we are so excited to have such a big group of people here. And I hope that the information that you're gathering today is ultimately going to be a blessing to you, and so that maybe you can take this information and go out and impact some others with that. So let me tell you a little bit about this group that that put this together. Our Health and Wellness Committee is a part of the Tomball Chamber, and really it's a collaborative effort among healthcare entities, providers, and businesses within the greater Northwest Houston region that provide health and wellness related platforms to support economic development. So the Alliance focuses on opportunities which support our healthcare professionals and wellness initiatives for a very healthy and vibrant community. So most of the members of this committee are Tomball Chamber members. We have regular meetings on a monthly basis to discuss the different topics that we're going to be presenting and our areas of focus. We have community lunches, we do blood drives. We have the Tomball Night Health and Wellness Expo that we've been doing for quite some time. And last year we had a very exciting addition. That was our Chamber Cup Challenge. And so if you have no idea what that is, please ask, because we would love to get you involved in that for this coming year. So we have a couple of reasons that this lunch is available and it's free for you guys. And number one is that we have a sponsor, and that is Tomball Regional Health Foundation. And at this time, I'm going to ask Jeffrey Klein, who's the CEO, to come on up and say a few things.
And thank you, Donna. And if you are on the Health and Wellness Committee, please join us on stage. I'd like to make a presentation to the committee. It is our pleasure once again at the Tomball Regional Health Foundation to sponsor the 3 luncheons this year. We are also a sponsor for the Tomball Night Health and Wellness event, and we've also signed on now to be a sponsor of the Chamber Cup. So health and wellness is what we do at the Tomball Regional Health Foundation, and we are so appreciative of the Tomball Chamber and the Health and Wellness Alliance within the Chamber for putting these together. So at this time, we'd like to present our ceremonial check to Donna and the crew.
Well, that was nice. We're so appreciative of their support over the years, and it's growing support, and we appreciate that so much. I'm also at this time going to ask Laura De La Rosa, who is hold on, my glasses back on, Senior Community Relations Specialist. I gave her a hard time because that's a lot. But she's with MD Anderson Cancer Center, and she is also a big part of what we do here. So I'm going to let her speak for a second.
Hi, everyone. What an amazing turnout. I love seeing all the faces in the room today. So MD Anderson is thrilled to be able to sponsor this event. We have 3 locations that are closest to Tomball. That is the Woodlands, we have West Houston, and we've just opened our Northwest Surgical Center, which is our first surgical center outside of the Texas Medical Center. It's off of Louetta and Cutton, and MD Anderson is proud to bring that service to the community. If you have any questions about cancer prevention, please come visit me at the table in the back. And thanks again for the opportunity to be here. Thank you.
Thank you. And lots of gratitude always just for this facility. For those of you that have events on a regular basis, you know what a challenge that can be. And so we're very thankful to be able to partner with the college and have a lot of our events here with the Chamber. Original Rib Tickler does a great job of providing lunch for us, and so a big thank you for them as well. I always ask them to do the healthiest lunch possible. We switched it up a little bit this year, so hopefully you guys are enjoying lunch. And then Jonetta B Productions. Miss Jonetta has always given us her services, her time, and she's videoing this for us. And so we will have that available probably via the chamber website, but we'll give you guys details for that because, again, this may be something that you need to pass along some of this information. We have featured businesses. So along the back wall, you guys have been, hopefully you've gotten to visit the tables, but you'll have time at the end. Also, if you missed having a conversation with somebody back there, American Legion Post 127, Air Ride Bikes is over here. Clarity Hearing is here. Concordia Lutheran High School, F45 Training Klein, Game Day Men's Health North Point, HCA Houston Healthcare Tomball, our MD Anderson Cancer Center, North Houston Hearing Solutions. Oasis did not make it today. Opus One is here, though. Renewal by Anderson of Houston. Seniors Helping Seniors. Shield Bearer Counseling Centers. And the Solana Vintage Park. And you guys give them a nice round of applause because y'all are good. Solana and some of the residents at Solana are the ones that do the centerpieces for the table. So we're super appreciative for that as well. So at this time, I'm going to ask the panelists to come on up and take your seat, and I will go through the introductions. And I've kept them brief today because, again, you're going to have a chance to get to know them. Rob Marmenstein he joined HCA Houston Healthcare Tomball as the Chief Executive Officer in the July of 2020. He came at a great time. He currently serves on our GTACC Board of Directors, and prior to his position with HCA Tomball, Rob served as the Chief Operating Officer for HCA Kingwood. He's held various leadership roles since joining HCA in 2008. Rob and his wife reside in Houston. They enjoy traveling, live music, gardening, and motorsports. Steve Shields is currently the inaugural Director of Guidance and Counseling in Tomball ISD, which launched in April of 2022. He came to Tomball from Fort Bend ISD, where he served 9 years as the Director of Behavioral Health and Wellness, the Director of Counseling and Post-Secondary Readiness. He has an extensive background and a passion for the field of mental wellness. And Jeff Burt took over as Tomball's Police Chief in June of 2020. We had a lot of 2020 things going on then, didn't we? After serving with the Los Angeles Police Department since 1996. We love that he brought his experience and professionalism, his family, and his love of community to Tomball. He leads by example, and as our city grows, he's focused on equipping our department to handle those challenges. So, as I mentioned, we have a pretty heavy topic today, and just a couple of comments. This was totally out of my wheelhouse, and in my vision of putting this together, there's a gentleman by the name of Kyle Matheson who grew up in Tomball. Some of you may know him. He spoke at a First Friday luncheon, I think that was last year sometime, and I really envisioned him emceeing this event, and he couldn't be here. And so he said, "No problem, I'll school you." And I'm like, okay. And so he did. And he spent time with me. He helped me develop questions. He helped me develop a PowerPoint. He just really was there. He's like, if you need anything, you just let me know. And so I want to give thanks to him for helping us get this pulled together for Tomball. And the other person that I want to thank is Bob Beely. And I just learned today that Bob Beely passed away on Friday. He was a devoted member of our committee. He was always there. And he's been on me for years to do this event on this topic. And I put my hands up and didn't want to do it. And you guys, this has probably been the largest turnout that we've had for quite some time. And so it's obviously a topic of concern. And I think in my mind, what I kept thinking about is the fact that we have all this information and we have a lot of statistics and numbers that have to do with Texas as a whole. We can bring it down to Harris County, and we have good information with that, but Houston is a big part of Harris County, right? But I wanted to know what was going on here in my community in Tomball. And so that's really kind of where how this came about. So just wanted to bring that to your attention. And then the next thing I want to say is that, you may be sitting here and you're wondering why this affects you. And does it affect you personally? And you never know who you're sitting next to, all right? And as I said a while ago, you're going to hear a lot of numbers and statistics and what's going on. And I wanted you to have the personal side of this story, right? There's more to this story than just those numbers and facts. And so we have a family in Tomball, and I'm going to ask Miss Penny Jennings to come up. And she's going to tell us her personal story. And if I'm not mistaken, this is the first time you've shared this publicly. So you guys just love on her because that's hard, all right? So her husband, Keith, is here. And Keith and Penny moved to Tomball in 1992 to raise their family. And their family business, Crow Manufacturing Corporation, was moved here in 1997, which they recently sold the company. Keith was the president and is now retired, and he has served numerous terms on our chamber board of directors. Penny also had a dance studio in town. So all 4 of their children went to Tomball ISD, and this family's been very active in our community, and we love them. And so Miss Penny, I'm just gonna turn it over to you.
If I lose my spouse, I am a widow. If I lose my parents, I am an orphan. But if I lose my child, there is no title worthy for that loss. My name is Penny Jennings, and my husband Keith and I will always be the parents of Cameron Duke Jennings. Cameron was our 3rd child out of 4, and he was our first boy. Cameron was the epitome of all boy. He loved being outside, and he loved playing all sports. He grew up surrounded by loving family and friends. And in return, Cameron loved fierce, and he would give anyone the shirt off of his back. I tell you all of this to set the tone of Cameron's life. Cameron had wanted to play football his whole life, but I took the advice of a friend, and I didn't let him start until his 5th grade year, and I regret that. He started his football career as a Tomball Redcat and was immediately placed as the quarterback. During those 2 years of Redcats, Cameron played quarterback, and he found his best friend Trace. I consider this the making of the future Tomball High School football team. Freshman year came, and wow, what a team. They had a play that I, as a mom, remembered to be outstanding. The center threw the ball to a player, who threw the ball to Cameron, who then threw the ball to the running back. First play of the game, and they got him every time. Fast forward. Mrs. Jennings, yes, this is the trainer for Tomball High School, and Cameron has been hurt. The beginning of his 11th grade year, Cameron took a tackle and dislocated his shoulder, and this was the beginning of the end. And as you see, Cameron was very competitive, and his goal was to be the starting quarterback his junior year. The injury meant he needed a surgery, and then there was an introduction to pain meds. And he lost his dreams of starting quarterback. What we didn't know then is that when the pain meds ran out, and he introduced himself to another means to help, marijuana. After high school, instead of college, Cameron went to a trade school at Lone Star College and got his certification for a machinist. He was so proud of this because he was the first family member of our family business that could actually run a machine in the machine shop. Cameron's goal was to run Crow Corporation one day, and he wanted to be able to run any machine and train an employee if necessary. One weekend, Cameron made the trip to San Marcos to see his girlfriend, and before he left the house, I told him what I had been telling my kids every morning before school: make good choices. Well, he didn't. He bought waxweed, and waxweed, if you have, is a possession that is a felony charge. And so he was in the parking garage at San Marcos smoking marijuana, but because he had the waxweed in the car, he was arrested and sent to jail. As some of you know, when you're arrested and have to go through the process of going to court and all that, it's a very lengthy process. And I think if it would have been a shorter timeline, that some of this could have been prevented. But our cycle started then. Cameron began taking drug tests weekly. Cameron had a friend that told him there was a better drug that Cameron initially declined. Our family dog then died, and her name was Roxy, which ironically is the street name for OxyContin. So Cameron tried OxyContin on that very day. And that was in July, and by October, he was fully addicted. I will never forget the day that I found out. I was on my way to a doctor's appointment for high blood pressure. When my husband called while he was taking Cameron to one of his monthly probation meetings, he told me, Cameron just told me he is addicted to oxys. I said, do you mean hydrocodone? Because I was thinking, how in the world did he get oxys? And my husband confirmed, and he said, oxys. My world quickly crumbled, but I tried putting it back together as best as I could. I immediately found him a spot at a place called Park. I now wonder if they would have seen the pandemic coming, if things would have been handled differently, because they released him only after being there 3 days. So our journey starts from there. I had him call his probation officer and tell her he needed to go to rehab. And she told him, just because your mommy thinks she can send you to some rich rehab, that's not okay. I wish I could hold her accountable to that, and yes, I do know her name. When we took him to La Hacienda for the first time, La Hacienda is a drug and alcohol rehab center, and it's in Hunt, Texas. We were recommended to take him there. It was a 30-day program, and I, being naive mom, thought we did the 30 days, my son is cured. Well, that's not what happens. What we realized and learned with him being there is your brain, if you are an addict to start with, is conditioned once you have that first bite of something that you love. You're immediately going to go to that, and you're going to bypass the other things such as water, beer, and you're going to go straight for the strong stuff. It was very enlightening, and we learned a lot from that. Many times during our experience, I told Cameron, if you had cancer, we could tell everyone what you're going through. But when you are going through a drug addiction, you don't tell your friends or your family. Most of what we went through for those years, we kept to ourselves. We as parents did everything we thought we should. We fought for our son, but what we didn't realize is opiates is an extremely addictive drug. Once the oxys got too costly and he switched to heroin, his chances of getting fentanyl-laced drugs more than doubled. And that's why the enemy has laced everything with it. Cameron was at the start of the fentanyl poisoning that our young people are being affected by. I remember telling him, Cameron, you never know when you're going to get a fentanyl mixed into something, and he would tell me that it was not a problem here. Looking back, I see it was just starting. We lost over 300 to fentanyl overdose in Harris and Montgomery counties in the year 2020. In 2021, Cameron was one of the numbers for the over 500 that we lost to fentanyl overdoses in Montgomery and Harris County. I include both counties because we live in Montgomery County, but Cameron's final dosage was from a drug dealer in Harris County. Why did the number have to double and go to over 600 in 2022? My opinion on this fentanyl position is that we are in our own world war. Other countries are poisoning our young kids, so they now can't stand up and fight for our own country. Because of that, my final question here today is, why is the place that my son was able to sell things such as weed eaters, PlayStations, jewelry, iPads, and eventually his own driver's license in exchange for drugs still open? My last day with Cameron was New Year's Eve 2020. We were sitting on the back porch, and he was telling me that he wanted to open a sober living house one day. He wanted to know my pros and cons of the ones we had experienced with him. Even though I have a vivid memory of that day and that conversation, I also knew in my heart, come Monday morning, I would be looking for a detox for him again. That didn't happen. I found him New Year's Day in a way a mother should never have to find her son. We chose to let Cameron live at home during all this because we didn't want him found on the streets. I am thankful for the peace of that. And just a final note, if any of you are going through any of this, my husband and I would love to meet with you, talk to you, because as you can see, we were a normal family. And it just took, we weren't a one and done, but one is all it takes. Thank you.
Thank you, Jennings family. Thank you, Penny. I know that was hard. And I hope that's something that just burns in your memory. And what a way to start this discussion. And I hope that you can just kind of keep that in your heart as we go through this information. So as you've kind of already heard, we're facing, and really we're going to start at the top. This is the United States, then to Texas, and then in Harris County. So in the U.S., fentanyl is now the leading cause of death for people 18 to 45 years old in the U.S. One American overdoses every 5 minutes. In 2022, more than 107,000 people died from drug overdoses in the United States. In Texas, more than 2,000 people died from fentanyl in Texas in 2022, and that is more than 5 Texans dying from fentanyl each day. Harris County has had almost a 500% increase in fentanyl deaths in the past 4 years. Nearly 50% of those drug-related deaths in Harris County involve fentanyl. Preliminary data for 2022 shows 579 overdose deaths in Harris County involving fentanyl and or other synthetic opioids. So it is the #1 drug threat. It's up to 50 times stronger than heroin and 100 times stronger than morphine. In 2020, 76% of drug deaths in people ages 15 to 24 involve fentanyl. So once you start hearing those statistics, I also had to bring the other side of this in because we're so thankful for the law enforcement and what they're protecting us from, okay? So when you look at the amount of fentanyl that's been seized, in 2023, almost 80 million pills, fentanyl pills, and 30,000 pounds of powder were seized. It didn't make it to the streets. It didn't make it to that end user. In 2024, right, you guys, we're not even halfway, we're a little more than halfway through the month. Already, 500,000 pills have been seized and 244 pounds of powder have been seized. 7 out of 10 DEA-tested pills with fentanyl were potentially deadly. So now we're going to talk to our panel a little bit and have some questions for them. And the first question is really how much fentanyl was seized in Tomball last year. And there are different types of fentanyl. And so if you guys can help us understand really what's going on around us here.
Hi, everyone. I usually am that inept, but I mean, that was an example of it. But good afternoon. I'm Jeff Burt. I'm the chief of police in Tomball, as was introduced. And before I answer, I just want to thank you all for coming here. This fentanyl is the crisis of our time. It is not uniquely an American crisis, but it is worse in America than any other country in the world. And it is our crisis. To hear from Penny and her family is, it's sad, it's powerful, it's gut-wrenching, and it is very real, and it is happening every single day. Our police department in Tomball, we have, in this last year, we've taken on, we put a canine in place, a canine to help us identify drugs. Pointedly, they don't teach canines how to identify fentanyl. They don't, because to sniff fentanyl for that dog would be a death sentence. So we are tracking drugs that are laced with fentanyl. So to answer the question, how much fentanyl was seized by Tomball Police Department, I looked at it from 2021 to 2023. We had 1.5 grams confirmed by the Harris County Forensics Lab and 4.1 grams suspected but not confirmed. So when I say that, we seize things that we believe are suspected. Testing takes a long time. There's a backlog in Harris County, as you can imagine, being the I think the third largest county in the United States, with a lot of drugs coming across the border, a lot of drugs coming in and out of this county, and law enforcement seizes a lot. So you say 5.5 grams, a raisin is a gram approximately. So you think 5.5 grams, that's not much. What are you guys doing? 0.2 grams of fentanyl, 2 milligrams of fentanyl is a lethal dose of fentanyl. 2 milligrams. There are 1,000 milligrams in a gram. So when you say, and we're saying we're testing, and we've seized 5.6 grams, and as our MC said, the vast majority of fentanyl seized in the United States are already lethal doses taken off the streets. So I'm proud of that number. The forms are most often a powdery white powder form, but we've had liquid form as well, and we've had a few cases of the blue pill form seized as well.
All right. How much of that was actually found in our schools?
Yeah, so testing? Okay, it's on. So we have not had a confirmed case of fentanyl, so there hasn't been any, and this was, our data lines up with, there hasn't been any yet found in our schools.
That's good.
It's a good thing.
Awesome.
Just briefly a comment on the amount. Chief Burt made the point, a few grams doesn't sound like a lot, but that's also what you have confirmed. So most of the fentanyl that is available to users that they might overdose on is in a pill that they think is something else, and that is almost entirely something else. It just has trace amounts of fentanyl in it. So to put things into perspective, 1 kilogram of fentanyl in its pure form is enough to overdose 500,000 people. So, a coffee cup full is enough to supply all of the illicit drug use in Harris and Montgomery counties for probably a year or more. So, and it's very difficult we don't see the concentrated form in the communities very much because it's already turned into laced into some other type of synthetic opioid or hydrocodone or something that somebody thinks that they're buying.
So a lot of what we're going to be talking today has to do with the schools, but Chief, are there other areas like in Tomball that we should be aware of? Like where, I don't even know what the words are, like where do they find this stuff?
No, it's a great question. Before I answer, I just want to comment because we are in the United States and we don't deal in kilograms and grams, we deal in pounds and ounces, strangely. But a lethal dose of fentanyl is about 2, if you think of table salt, 2 bits of salt, 2 pieces of salt. 2 to 4 pieces of salt is a lethal dose. That's the size of what we're talking about when it comes to what is a lethal dose and how horribly and quickly that can be ingested in somebody's body. So the question is, we're not finding it in the schools. Where are we finding fentanyl? Most often, our fentanyl arrests and most of our illicit drug arrests come from our hotels and our apartment complexes. So we have a great body of hotel managers here in Tomball, and we work really, really closely with them. But sometimes people who are people who are not on their best foot find themselves in local hotels, and people who are trying to get away and hide something may leave their house and go to a hotel. That's where we find it. So most of it is concentrated in apartment complexes and hotels.
Okay, thank you. The next question we have is, what is currently the #1 drug threat in Tomball based on our believed use, arrests, and seizures?
You want to start with schools? Or?
I mean, I can just say that marijuana, obviously vaping, THC, that's probably our most common. I'm not sure what as far as seizures and arrests, but that's what we're seeing the most of.
In the hospitals, when we have patients who come in with substance use issues, it is more commonly than not methamphetamine or heroin related. Sometimes opioid related, but typically not as much.
And I have the same sense from our officers. I think the drug of choice that we see most often is our methamphetamines. We do get a mixed bag of pills, and whether those are actually illicitly manufactured or they're real pills stolen and sold, we get a mixed bag of those. But methamphetamine, like a large chunk of the United States, is primarily the drug that is most often abused. Most common is marijuana, and obviously marijuana, as much as I cannot stand the drug in any of its forms, it is often taken with a lesser effect. People who are on meth are stuck on meth, and we've all seen the effects of that. Second, and a close second to methamphetamine, is heroin. We do get brown tar heroin, most common. Brown tar heroin is generally out of Mexico. It's grown there, manufactured there, and then transported, sold in little balloons, essentially, that the dealers will mouth hold and or hold elsewhere in their body, and then give to the buyer.
All right. Thank you, guys. So we're going to move on a little bit and just talk about fentanyl itself, because if you're like me, like a lot of this is new information, and I had really no idea. Part of what makes fentanyl so dangerous is the fact that it is a powerful synthetic opioid. A lot of times it is prescribed by a doctor, and originally it was to treat pain, but obviously not all fentanyl does come from the pharmacy. Because it is so potent and addictive and cheap to make, the illegal drug manufacturers often use these chemicals to make their own fentanyl. It's added to other drugs. It makes them stronger. It can be found in cocaine, heroin, methamphetamines, Molly, lots of other drugs. Illegal drug makers also used fentanyl to create counterfeit pills that look like real medication. And that's what we have a couple of indications from the pictures up there. It's pretty crazy what they're doing with these, with the presses that they have. This one picture, when I saw this picture, if you're in my age group or older, this top picture is really what we thought about, right, when we thought about drug use. And unfortunately, having a pill is much more socially acceptable, right? We're not as suspect of that. So what happens when people take fentanyl, it causes confusion, drowsiness, dizziness, nausea, vomiting, changes in pupil size, cold and clammy skin, coma, and respiratory failure, leading to death. The people who want to experiment or self-medicate with prescription medication, they may buy a few pills and accidentally consume fentanyl, and those are a lot of the stories that we hear about. It's become so common that even a pill from a trusted friend may not be safe. And treatment providers, this is the part to me that is really disturbing, in that treatment providers also report that there's been a huge increase in individuals that are actually seeking drugs that contain fentanyl or are choosing to use that drug as their drug of choice. And so there's been a corresponding rise in patients entering treatment facilities specifically for fentanyl addiction. So the good news is that there is something that can help if you find someone who's in need, and we call that Narcan. And because fentanyl is so strong that an overdose can happen within moments of ingestion, and the brain damage actually occurs when you have 4 minutes without breathing, and death can occur 4 to 6 minutes later. And unfortunately, if EMS is not able to respond within those first few critical moments, then having this spray may actually help to save a life. And so I went on what we all do. I went on the internet and I said, okay, well, what if I wanted to get some Narcan? Like, it's not hard to get. It's about $45 for a 2-pack. And you can get it without a prescription in all 50 states. And so basically, if there's someone that shows signs of an overdose, don't wait, right? Immediately call 911, but then you can give them this nasal spray and perhaps save their life, okay? So super important to kind of understand and know that. So back to our panel. So Rob, we've kind of touched on the dangers of fentanyl, but can you give the audience just a little bit more insight into what you guys are seeing at the hospital in the ER and kind of expand on that a little bit for us?
Sure. Before I do that, another 2 or 3 comments on Narcan. So it wasn't until early last year that it was reclassified as an over-the-counter drug. Previously, you needed a prescription for it. I'm not really sure how that started and why, but now, Donna, as you mentioned, you can get it over the counter. It does not have side effects. It does not cause complications, and it reverses the overdose symptoms related to narcotics and opioids. And it's easy to use, and it's something that, just like, it used to be nobody knew anything about AEDs that we had in schools or in malls or things like that, automatic defibrillators. It used to be nobody knew how to use a tourniquet, and then there's been a big push for learning how to stop the bleed. You may have attended a Stop the Bleed class. I think it's very important that the community is well aware that this is an easy-to-use product when someone might be having an acute overdose response.
And you can't cause harm. Like if you use it on someone and they didn't really need it, it's no harm, no foul, right?
No foul. It is no complications, no side effects, and it's absorbed through your mucus in your nasal canal. So sometimes I hear, well, the person's not breathing, so why are you going to shoot something in their nose? Well, it gets absorbed into their system that way, and it's really pretty amazing if you're able to get to somebody in time.
Yeah, but Kyle explained to me, it's the only thing that can flip the switch in the brain.
It flips the switch. It's
Yeah.
pretty remarkable. What we see in the hospital, a fentanyl overdose or fentanyl-related injury, if that's a word that I can use here, is actually pretty uncommon to see in the hospital because typically a patient will either be found and they will have already arrested and pronounced at the scene, or they'll be found quickly enough, promptly enough, where they are administered Narcan by a friend, their family, law enforcement, EMS, et cetera, and it does reverse the process, and by the time they're brought to the hospital, they're not experiencing acute symptoms anymore, and we treat them for whatever's left and generally discharge them. They don't even have to be admitted, which is a pretty incredible thing to see. So the short version of the story is we don't see a lot of fentanyl in the hospital, but you would see it a lot more in the community.
Okay, thank you. So next little series of questions would be how many overdose deaths have the police department responded to in the last couple of years? And then I think Robbie may have already answered this, the hospital, and then, of course, at the school. So I'll let you start, Chief.
If I could, yeah. When it comes to Narcan, I wanted to acknowledge one of my officers, John Willard, in the back. Can you raise your hand? John actually successfully utilized Narcan, and I was hoping I could get, if you don't mind, could I speak for about a minute on the just what the process was, and how we talk about flipping a switch. And from my experience, it's really that amazing. But ladies and gentlemen, Officer John Willard, and let him talk.
Thanks so much for being here. So being on patrol, we respond to a variety of different calls. And I remember this specific day that happened. It was toward the middle of my shift, and there were 2 emergency calls that happened. We have these emergency calls called tone-outs. So on our radio, these emergency calls come out. There's 2 of them. There was, sorry, let me take this out because they're talking to me. So I responded to an overdose call at an apartment complex here in town, and didn't know exactly where the apartment was, trying to figure it out, talking to EMS, fire. We beat everybody there. Police beat the fire and EMS there. And I go into the apartment complex, and I keep Narcan on me. I keep 2 in this pocket. I'll show you. I keep 2 in this pocket, and I keep 1 on my right side. So 2 is for the patient, 1's in case I need it myself. So I keep 3 Narcan on me at all time. So I walk into this room, and there was a boyfriend-girlfriend situation, and a lady, she's dead. Her heart's she's not breathing, no pulse, nothing. So I started asking the questions. I see drug paraphernalia in the apartment complex and or apartment. And I asked the question, I said, does she use? And said, yes. It says, okay, Narcan. So then I started doing CPR on her, I was like, come on. I'm gonna call her Hannah. Hannah, come on. And I'm doing CPR. And I Narcaned her again. And all of a sudden, Hannah started breathing. And I tell you, like, it's an incredible tool to have for anybody to have, just in case. Like I said, no foul. Like if she wasn't overdosing on opioids, but she overdosed on fentanyl. And as far as I know, today she's still living. So just an awesome opportunity to save a life.
Way to steal my thunder, you jerk. You're fired. All right. I have like some bubble gum in my pocket. I could just throw it at people. So was the question number of Narcan deployments? Or, okay, number
No, overdose deaths.
overdose deaths. In fentanyl-related deaths, we have had 2, and they were both in 2022 in the city of Tomball. And your numbers were updated in 2022. I'll just go for all counties. So all the law enforcement agencies in Harris County. In 2021, there were 484 deaths from fentanyl that law enforcement responded to in Harris County. 583 deaths in 2022, and in 491 deaths in 2023. Tomball, the city, 2. But based on our population, that's about right on.
All right. Any other additions to?
So we haven't had any overdoses at the school. There was a Narcan deployment. We can't confirm if it was fentanyl, but there was Narcan deployed at one of our campuses a couple years ago.
That's encouraging.
Yeah, it is encouraging.
So we've already kind of addressed this. Like our patrol officers, our school resource officers, they carry Narcan as part of their gear. Is that correct? Correct. All of them. Okay, including yourself, Chief. Yes. All right. Good answer. Good answer. Can you talk to me a little bit about what goes on in the schools with the Narcan, with regard to Narcan?
Yeah, so all of our campuses have Narcan and Tomball ISD. In reference to, I think there's a question about if there is like multiple overdoses, do we have enough doses on hand? So our high schools have a total of 28 doses. And just to let you know, so the nurses and the school resource officers are all trained how to use it. All of the secondary administrators have also gone through a district level training on how to use it. So teachers at this point do not have like a supply in their classroom. It's more like they're called a nurse to deploy it or the school resource officer. So that's kind of where things are at right now in Tomball with Narcan.
Okay, thank you. At the hospital, we don't really, do we have Narcan on deck there?
I mean, we have everything.
We have everything. Okay, good answer there, Rob.
We have lots of fentanyl as well, but it is very rarely deployed. I'm not aware of a time recently where we did have to use it in the ER, because as I mentioned earlier, if someone's overdosed and it's not deployed in the field, they're not making it to the hospital.
Right. So you've already kind of answered our question, and when I was talking to Kyle, he was so adamant about this point. Like there can't be too many people that have Narcan, all right? So and he said it's really not unusual for there to be multiple people that would need it at one time. That's not unusual. And the other thing that was explained to me is the fact that whenever, and we haven't gotten to this point of the slides yet, I'm speaking out of turn here, but if I don't say it, I might not remember. But when they make these pills, like the fentanyl clumps up, he said. And so let's say he's making 10 pills, and they all are supposed to have fentanyl in them. Well, some of them may end up with very little, not enough to, cause harm. But then the other, 5 have like this, an abundance of it that is a lethal dose. So they have no idea what they're doing, right? These are not people they're not pharmaceutical grade people that are creating this mess that we're in. So that kind of brings us to the business of fentanyl. This was very eye-opening to me because there is a business behind this, right? And we forget that. illustration, this truck that we see trucks on the road all the time, if you were to fill this truck with material, it can hold about 675 cubic feet of material, okay? That second yellow bar that you see there is heroin, 2,830 cubic feet of heroin, which would be enough for 1 year of U.S. consumption. And remember that heroin is, you have to farm heroin, right? It's a mass production, okay? But then look what happens when it comes to fentanyl. Basically, 1 year of U.S. consumption is only 161 cubic feet. So the transportation methods are not as extensive. The profit margins are huge because of the potency, less is more, and the overhead is minimal. So there's no farming such as heroin because we're talking about a synthetic drug versus a drug that has to be farmed. Does that make sense? That was like hugely eye-opening to me when I learned that. These couple of pictures actually came from areas that were within our vicinity, okay? Not necessarily Tomball, but surrounding areas. And I know that they're hard to see, but what you see up there is they're using pill presses, and they can be purchased online for approximately a couple $1,000s, and they can make up to 4,000 pills in an hour. The total cost of ingredients is probably less than $1,000, but they can put out 8,400, they call them N30 pills. Tell me what that stands for, I forgot. Is it the little blue pills, right? I don't remember what they're called. But they sell them for about $8 each, and they're gonna net $6,700, I'm sorry. So you see the profit margins in this, and they have no idea what they're doing other than the fact that they wanna make money. The fact that fentanyl is killing many actually appeals to some of the users because they feel if others are overdosing, well, this stuff must be really good. But they believe that they have discretion when they're ingesting, that they know what they're doing. That's not unusual, I don't think. So we have two things that are working against us here, availability and cost. The fact that fentanyl is no longer just prescribed by a doctor, right? Now they can get it from their street dealer. And the social marketing is making it really hard for those of us to kind of keep tabs on it all because they're using Telegram and Snap and Instagram and things I probably don't even know what they are. So we have a lot to learn and a lot to be aware of, especially as caretakers, just trying to have that awareness of what's going on around us. So back to our panel again, has the police department been involved with any of the counterfeit pill manufacturing sites or any meth conversion labs in or near Tomball? Do we have an issue there?
We have not taken down an illicit lab. We have come across, obviously, we've arrested dealers, we've arrested people who are transporting significant quantities of drugs that could kill hundreds of people, but we have not taken down a manufacturing lab. We have worked with other agencies as we do. It's a regional approach when we're dealing with an international problem. So we've worked with the Drug Enforcement Administration, Harris County and Montgomery County law enforcement officials to work in a task force model to provide intelligence and response to drug areas, but not in the city, within the city limits of Tomball.
All right. Anybody else want to add anything to that? Okay. So I think it's important to understand like what is happening on the positive side. What are we doing? And I'm just going to read through these because again, this is all information that's new to me personally. But House Bill number 6 creates a criminal offense of murder for supplying fentanyl that results in death. It enhances the criminal penalty for the manufacturing or delivery of fentanyl and requires deaths caused by fentanyl to be designated as fentanyl toxicity or fentanyl poisoning on a death certificate. Current law does not require such classification on death certificate, with most fentanyl-related deaths currently classified as just an overdose. House Bill 3144 established October as Fentanyl Poisoning Awareness Month to help increase awareness of the dangers of fentanyl. And House Bill 3908, also known as Tucker's Law, requires public schools each year to provide research-based instruction on fentanyl abuse prevention and drug poisoning awareness to students grades 6 through 12. The bill also requires the governor to designate a fentanyl poisoning awareness week. Senate Bill 867 allows the distribution of opioid antagonists, including life-saving Narcan, to Texas colleges and universities to prevent opioid poisonings, which we haven't really even talked about what's kind of going on in our college system yet. And this is, I think, something that we just need to understand and really develop an opinion about. There are a lot of Texans in Congress right now that are trying to lead a bipartisan effort to allow fentanyl test strips. So what I found out about that is that obviously you can't see, smell, taste if a drug contains fentanyl. And these test strips can show if it's present, but not how much. And so a lot of the drug checking tools are increasingly popular, life-saving, and harm reduction. It's a great measure that we take towards that. But a lot of the states, including Texas, classify these test strips as drug paraphernalia, and it makes them illegal to possess. And so there's a big push to have that changed. The legislation comes after a bill to decriminalize the test strips passed the Texas House, but died in the Senate despite efforts from the support from Governor Greg Abbott. And several states are trying to make a similar move to remove the testing strips from their drug paraphernalia list. So I wanted you guys to know that because it may urge you to make some phone calls, right, if that's important to you.
Donna, can I quickly comment on the
Yes.
test strips? So the bill that was introduced in the House, Dr. Tom Oliverson, who many of you are familiar with, worked on that, passed the House, bipartisan, makes a lot of sense, harm reduction, was not brought to the Senate because there are perspectives that I can understand that people have that I hope this kind of conversation will change. So fentanyl test strips are, as Donna described, a way where if you're going to take pills, you can use these things to make sure that your pills at least don't contain this extra deadly thing, right? And it's a harm reduction strategy. There are some attitudes that, well, why should you use legislation to make drug addiction safer or be soft on crime or other things like that really sound good in sound bites. But if you're just trying to ensure that we're making the population as safe as possible, maybe that's not the most effectual thing. So all of you, if you took out your phone right now and got on Amazon, there's 100 types of fentanyl test strips. You can select them, they've all got reviews and everything, and as soon as you put them in your cart and you put your zip code in, Amazon will say, oh, sorry, can't deliver to this address. So they are legal in many parts of the country. They are illegal in many parts of the country. And I think that just like this whole conversation, awareness helps change some of that.
Thank you. Yes, so again, back to House Bill 6, where our dealers can be charged with murder, has Tomball Police had any of that happen since it became law? Have we had any charges been filed?
No,
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 okay.
we've not had we've not had a death, and since that bill passed into law from fentanyl, and and then we've not linked a specific user to a specific dealer, and that really is, the law sounds great, and I, as a private citizen, absolutely support the law that we're calling it what it is. People who are making this stuff for money are murdering Americans. They're consciously creating a substance that will kill, that we know kills, and then delivering it to people. And it may kill on the first time it crosses a person's lips. So fully support it. The hurdles for law enforcement to cross are, of course, our American Constitution, probable cause, that we have to identify and link this person knowingly dealt this drug to this person who is now deceased. And that's a harder combination than you would think. But we will 100% go at that full full tilt if we come across that situation.
Absolutely. This talks about the education, House Bill 3908, Tucker's Law, and so kind of directed at the school district, and I wanted you to speak to that. And I put these together for you just as a talking point because I know that you guys have already done a good bit of education within our school district.
Thank you. Yeah, so I would say that, to be honest, that we have just started this journey of educating our community, our parents, our students. But we did, I think, this year have some pretty powerful events. So as part of the October Fentanyl Awareness Month, we did partner with MCOPE, which is the Montgomery County Overdose Prevention Endeavor. And they came into our school and spent 2 days. They had a presentation that they ran all 3,000 of Tomball High School students through in the auditorium in smaller groups. The felony chief division, Donna Hansen was one of the presenters, as well as Dr. Jordan Whitcup, who is a chemist who also lost a child to a fentanyl overdose. So they did a similar presentation about just talking about the lethality of fentanyl and just to get the kids to understand what they're up against. And so we did do a post survey with the kids, and they responded extremely positive to the event because there was also we also brought in the Texas Memorial Walk, which is a very powerful. You can see pictures up there. So there is we had room. There's more of these, but we had room for 100 young people that have lost their lives to a drug overdose, and it tells it has a picture of them, and it tells their story. The kids, as they're heading into it, were kind of laughing, and once they got inside, they were so somber, respectful, some tearful, and so I think that additional piece, along with the education, was extremely powerful. So we did do a post survey, and sometimes with high school kids, you don't know what you're going to get with those surveys, but there was 90% of the students that were surveyed said that this was impactful, and then like over 90% said that they would recommend it to a peer, and like out of almost 1,000, there's only 10 kids that said they would not recommend it. So we got a very good feedback on the event, and then they also did a parent university event. We've had 2 parent universities event this year. So the same speaker stayed for the parent event. The parents were also, and community members were also allowed to walk through the memorial walk, and so we had about 80 to 100 parents show up for that, which we thought was really good. And then we also recently did an event about 2 weeks ago, and we partnered with Tomball PD, where one of our sessions in the parent university was the substance awareness above the influence, where Sergeant Coco White just talked about fentanyl, talked about some of the other substance use and abuse trends that he's seeing in the community. That was also very well attended. I think the combination of some mental health topics as well as the drug topic was powerful. So we also on our campuses, like I said, we have begun the journey of educating our kids. So one of the intermediate campuses, which I think is really good, starting with 6th graders, brought in Crime Stoppers. So Crime Stoppers did a presentation for all the 6th graders about the danger of fentanyl and other substances. Also, the other intermediate campuses, they also did some modules, some education modules with their students in October during the Fentanyl Awareness Month. We also have connected MCOPE. We have another huge high school, as you know, Tomball Memorial, which is another 3,000 of our high school students. So they are currently working with, MCOPE is working with Tomball Memorial to continue and to bring the event that they did at Tomball High School to our other big campus. And also we're in the works, we have a Tomball Star Academy, which is our early college high school. They're also working with MCOPE to bring that presentation to kids and families. So that's kind of so far what we're working on in Tomball ISD. We definitely see, and like the passion I have for just doing this work is just thinking about like, if this only like saves one person, it's worth all the work and energy, so.
Thank you. I just think we have an amazing community. I've seen it in action over the years, and the fact that we're having this discussion, I hope we be able to further this discussion, right? And the collaboration between just the 3 that we have up here, right? So thank you. Anybody else have any comments on this? Okay, go ahead.
I forgot to answer one question.
Yes.
We have deployed in the last 3 years Narcan 31 times in Tomball PD. So I reported 2 deaths in 2022, but 31 other times we were, like Officer John Willard shared, we were able to revive a person on scene utilizing Narcan. And the number's going up. 17 of those cases were last year in 2023. So 17, over half of the cases where we deployed Narcan successfully and brought somebody back were last year.
Great, thank you. So, and this may be a moot point because I am very encouraged. I don't know about the audience, but I'm very encouraged to hear that it doesn't sound like it's an overwhelming issue yet in Tomball. Would we say that? Like, do you guys feel like we're on the positive side of this, right? I mean, I think if we can continue to educate, but then on the other side, what are some of the disciplinary actions? Like if we do have someone that we find in our school district, what happens?
Yeah, so if a student would be found with fentanyl or any other substance, so it is a mandatory. It's called a DAP placement, which is our disciplinary alternative education program, which is a separate school. It's called Tomball Connections. And basically the amount of time spent there is dependent on just the assessment of the situation. Was the student selling it? Obviously the charges that come, the penal code charges, whether it's a felony, which I'll talk a little bit about that in a second. That'll depend on the amount of time that they're off of campus. And one of the things I want to mention is that, so if a student would be found, and when a student is found with any substance, we do have a program called the RISE program, which all of our students, and it's funded by our Tomball Regional Health Foundation through a generous grant. They have access to education and also free counseling by a licensed professional counselor. So we had over about 80 students last year that completed the program in Tomball ISD, just for whether it was marijuana, alcohol, any type of infraction like that. So if there is a possession of fentanyl, and if it was charged with a felony, then that student would automatically be expelled to our juvenile justice alternative education program. That's a mandatory expulsion if it's found as a felony drug possession. So that's kind of if something like that would happen. Like I think the combination I think is always powerful, is a combination of really strong consequences, but also understanding that these are kids. And these are kids that made a mistake and that they have their whole lives in front of them. So also having that treatment, regardless of their income, their background, this treatment is provided during the school day. It's provided while they're at the DAP, so it's part of their school day, so the parents don't have to transport them to get treatment. So it's really meant to remove the barrier so the students that need these services the most have access. And again, I do want to thank the Tomball Regional Health Foundation grant, because we just received another $200,000, which we'll be getting shortly, that we'll use to fund both the RISE program as well as just the growing mental health needs that we're seeing in our community. So thank you.
Awesome, thank you, go ahead.
And from a law enforcement perspective, I want to be careful saying that we're on a better end, and I am concerned, and I'll start. My main concern is this: Penny and her family are a normal Tomball family. This happens over and over, hundreds of times a week in the United States, thousands, tens of thousands of times a year in the United States. And I think 70,000 deaths were attributed to fentanyl last year or more. And so I would be disingenuous to say we're doing okay in Tomball. 75% of my crime in the city of Tomball, I call it mine because that's That's what I get paid to do, is drive down crime. And when I'm not driving down crime, that's my problem. And so when we have 75% of our crime is being committed by criminals who do not live in Tomball, but they come out from Houston. The same reason our house prices maybe have better value because we live next to a big, beautiful, shining city, but because people want to move out and have a better life, so too do criminals say, hey, I've run out of catalytic converters to take in South Houston, I'll come to Tomball. My concern is when we live next to a border, when we live next to the fourth largest city in the United States, these are problems that are squarely on not just my shoulders, my cop shoulders, all of our shoulders. We do have a fentanyl problem in Tomball. When we have 2 deaths a year, I take that seriously. When we've issued Narcan 31 times, I think that is something that I worry about and keeps me up at night. I don't see the trend. It's certainly not reversing on a national level. It may be flattening out according to Columbia University, but 75,000 deaths a year is 75,000 too many. So I feel like the shining light in this, I applaud the state of Texas to make it a to make it a capital punishment, to make it a murder charge. I applaud groups such as the Greater Tomball Area Chamber of Commerce who have the wisdom, the compassion, and the insight to say, let's get community leaders here and talk about this. Let's educate them on these little pills and these problems that are America's problem. And so I think the answer is a bright, engaged community, great partnerships between our hospitals and our schools, and honest communication back and forth, and then understanding what we're going up against, because that's what will beat this.
Awesome. Thank you, Chief. I love that point of clarification, and I think you're right. The fact that we have, as a community, just a strong collaboration amongst us really puts us in a better position than a lot of communities can say, right? I appreciate that. So basically today we've gotten the facts. I hope that you guys will be able to leave here with a little bit more information than you arrived with. We've talked about the ways that we can reduce the risk. You know, for those that are that you're only taking prescription pills, that you know exactly what you're taking and why. We're not mixing substances. We know the signs now of what can happen. We know the importance of having access to Narcan. We're prepared to act. I think just thinking ahead, being in situations and understanding what your path to action would be. And then for those that want to really have that discussion about the test strips, like we've engaged that a little bit, so we can have those open discussions. And helping our friends, right? Taking a look around us, knowing who we're talking to, how to get support and treatment. You guys, there are so many areas and agencies and organizations that are such key parts of Tomball that can help this, right? And so a lot of them are represented here today, and I hope that you are that you're asking questions and helping to spread the word. Again, we'll have the information available so that you can do that once we have the recording for this. I'm just gonna flip through these questions real quick to see if there's anything else. If you guys we're talking about spreading awareness, anything that you have with regard to spreading awareness. And then I just thought this was interesting too, this question really, because there is recreational drug use, right? Where an individual may accidentally take a drug that they did not intend to take that contains fentanyl. We all understand that. But then there's also the substance addiction, where an individual finds themselves really kind of in that repetitive cycle. And they may want to stop, but how can we create that environment where individuals that are struggling with addiction can find a safe place? Not everyone has a loving home, right, that they can depend on their families. Not everyone has access to that. How can we keep them able to find that safe place without fear of judgment or prosecution?
A comment on that. When you said a minute ago, helping our friends, right? When Penny was sharing her story, and thank you, both of you, Penny and Keith, for doing that. one of the things that really struck me is, if we had this illness, we'd be talking about it with our friends. If we had this issue, we'd be talking about it with, our church, whoever. When you have a substance use problem, it is very stigmatized, and those individuals and those families frequently keep it to themselves, right? So caring for our friends, being a better, more well-informed community, understanding what services are available, and making it safe for someone to seek help versus like suffering in silence until their suffering is done, makes all the difference in the world. So the things I wrote down as we were going through all that, there are two things that we need to focus on as a community. One, preparedness. So do people have access to Narcan, or are you aware of what it is and how to use it, et cetera? We've talked about that. And then awareness, right? We can increase charges to drug dealers. We can take more pills and more dealers off the streets, and that can impact the supply side, but the demand is what drives it, right? So it doesn't matter how many drug dealers you put away. If someone's still there to buy the product, it's going to figure out a way to get to market. So the more awareness we do, and I love what you talked about with the seminar in the school, the more awareness that we have, the more people, may not be looking to purchase pills or things like that, and look for other healthier ways to whatever they do, right? And I think it'd be a little naive to think we can legislate morality into this situation. We also have to band together as a community, share information, not be ashamed of it because it's stigmatized, and prop each other up.
Thank you. Any other closing remarks, Chief?
Just that, both these, I wanted to recognize the school, TISD, and I was in Los Angeles for a long time, it was stated, but coming to and seeing how, in my mind, a school is supposed to be run with some of the most engaged and heartfelt counselors that I've ever met. And to what Donna was saying, where kids go about 40 hours a week to school, they have a family environment there, a non-judgmental, very, very bright, very engaged community of leaders that love these kids, give guidance and counseling. And I don't know how much, because I can't talk about what was prevented because it never happened, but how many times the counselors at TISD jumped in and saved the day and steered a kid on the right path. So I wanted to recognize that because we truly have an amazing school system that has an eye out for that and have saved lives. So thank you.
Thank you. And I also wanted to, we do have a group of Tomball ISD counselors back there. So they are truly amazing. Yeah, and just really quickly, I think creating that environment, like you were saying, so definitely Dr. Zamora Salazar, like she, from the top down, it's a district that prioritizes relationships first. So I think if kids feel like there's adults on campus that care about them, that helps for them to have a safe place to go talk. Also, when they see that there's therapeutic services, like not just a school counselor, but therapeutic services from a licensed counselor in their school, that communicates that, hey, we're okay. We know that kids struggle with mental health. We know that they struggle with drug dependency, substance use and abuse, but we also want to help. And so just having those services available can really relieve the stigma.
Awesome. Thank you. Thank you all so much. Before, I'm going to let you give them one round of applause here in a second. Before I do, if you have a question, obviously we are pushing 1 o'clock. You guys have been such a kind audience. I'm so appreciative of you being here and being so attentive. But if you do have a question, we obviously do not have time for any more questions, but we do want your questions, right? So please feel free after we end this to bring them up here, and we will do our very best to get those answered for you. Yes. Okay, so as a final just reminder about our committee and some of the things that are coming up, if you want to get involved, I'm going to leave this up here so that you can see it. I will also say that there is a lot of information that you can find when you search even just DEA, right? I mean, and fentanyl, there's a lot of information that's out there that you can get just to kind of support what you've started learning here. And so again, I think that just creating that awareness is going to be super helpful to all of us. And now, if you guys would just really show your appreciation to our panelists, I greatly appreciate you guys. All right, so as we have door prizes, so if you guys take a seat for really quick, I'm gonna call, where's Amy? Amy, if you wanna come up here and do door prizes, that'd be super. And then Jeffrey, if you wanna go ahead and make an introduction, that would be great while we get situated here.
Folks, if you're here and you have a child in your family that's struggling with drug or alcohol or whatever dependency, Thad and Stan, if y'all will stand up. We have two folks at our table today. We have Thad Cardine with Shield Bearer Counseling, and then we have Stan Nelson with Centacor Rehabilitation. They do drug and alcohol rehabilitation. So folks, if y'all need to have a conversation with someone you don't know who to talk to, start with one of these gentlemen today.